So there's been some pretty big news out recently from the CDC, the Centers for Disease Control and Prevention.
Mm-hmm.
They've updated their travel advice, and it's quite a shift. Now, they're basically recommending you get vaccinated against measles, the MMR shot,
Right.
for any international travel. Doesn't matter where you're going.
Yeah. And what's really striking, when you dig into the sources you pulled, you've got Associated Press, CBS News, Daily Mail, Gazette Textra here, is that this change, this travel advice, it isn't just about outbreaks happening somewhere else, far away.
No.
It seems to be, well, a reflection of something concerning happening right here in the U.S.
Exactly. A real surge in measles cases and these documented drops in childhood vaccination rates.
Right, across the country.
So that's what this deep dive is about. We want to use these sources to really, unpack what's going on, look at the data, understand the risks.
And figure out what it all means for you listening in.
Okay, so maybe let's start with the basics. Just remind ourselves what measles actually is based on these reports.
Sure. It's a viral illness. And the experts quoted in, well, all of these sources, they describe it pretty consistently.
How so?
As one of the most, maybe even the most infectious diseases known, especially for people who aren't immune.
That contagiousness, it really jumps out from the reporting, doesn't it?
It really does.
It's almost like hard to visualize. One person with measles, they can infect up to 90% of the people around them if those people aren't immune.
90%.
Huh.
And the average patient, if you took away vaccines, could potentially infect, up to 18 other people?
18. That's an incredibly efficient virus.
It is. And it's presentable, sure, but it's definitely not harmless if you get it, particularly if you're unvaccinated.
Yeah, the sources are pretty clear on the severity risks. Like about 1 in 5 people who get infected actually need to be hospitalized.
Mm-hmm. And for kids, about 1 in 20 can get pneumonia. That's a serious complication.
And tragically, the reporting confirms this too. There have been at least 3 measles deaths in the U.S. this year.
Which is the first time that's happened in a decade, right?
Yeah, it's the first time in a decade. And all 3 individuals, the reports state, were unvaccinated.
So the main tool we have is that MMR vaccine. Measles, mumps, rubella.
Right. And the sources cite its effectiveness. 2 doses are about 97% effective at preventing measles, which is really good.
It's very effective. And that effectiveness is the whole basis for, public health's main defense strategy, herd immunity.
Can you just briefly explain that again?
Sure. It's the idea that if you get a really high percentage of the population vaccinated for measles, the magic number is usually cited around 95%.
Okay.
It creates this, collective shield. It makes it super difficult for the disease to find susceptible people and spread. So it protects everyone, even those who can't get vaccinated, like very young babies or people with compromised immune systems.
Okay. So that 95% is key. But here's where the sources, they reveal the main problem we're facing now.
Yeah, this is the concerning part. Childhood vaccination rates for measles, they're actually going down here in the U.S.
Actively declining.
Yes, and there's a significant study mentioned in these articles from Johns Hopkins University.
Right, I saw that. They looked at a huge amount of data, didn't they?
They did. Over 2,000 counties across 33 states. That's quite comprehensive.
And the findings were, pretty stark.
Very stark. They found that 78% of the counties they studied, that's over 1,600 counties, saw a drop in their MMR vaccination rates just over the last year.
78%. Wow.
And if you look at the average across all those counties they studied, the rate fell nationally by about 3% since before the pandemic started.
Okay, so from about 94% down to just over 91%.
Exactly. From 93.92% pre-pandemic to 91.26% post-pandemic. Now, 3% might not sound like a massive number on its own.
But relative to that 95% threshold.
Precisely. The sources really hammer this point home. A drop like that pushes large areas, potentially millions of people, well below that critical level needed for strong herd immunity.
And the CDC's own data, specifically for kindergartners, seems to back this up too, right?
It does. Their numbers show a similar drop from about 95.2% in the 2019-20 school year down to 92.7% for the most recent school year, 2023-24.
So multiple data sets pointing the same way.
Downwards. Yep. And there's a quote from an expert in one of the articles that really sums it up. They said something like, a lot of counties are well below the 95%, so we're quite vulnerable.
In certain pockets in particular of the country for a measles outbreak. Yeah, I remember reading that. It makes sense.
It paints a picture of vulnerability, especially in specific communities where those rates might be even lower than the average.
Though it's not happening everywhere equally, the Johns Hopkins data did show some variation.
That's true. It wasn't a uniform decline. While most counties went down, they found 4 states, I think it was California, Connecticut, Maine, and New York, where the average county level rates actually increased slightly.
Interesting. So there's definitely regional variation.
Significant diversity, yeah. But the overall trend is down.
And we're seeing the impact of that trend, right, in the actual number of measles cases.
Directly. The sources all note that the U.S. has now passed 1,000 measles cases this year.
Which is the first time we've hit that number in 5 years, since that big outbreak in 2019.
Right. 2019 had, nearly 1,300 cases?
Yeah.
And just for context, going back further, the 1990 outbreak had over 27,000 cases.
Whoa.
But hitting 1,000 now is still really significant, especially considering measles was declared eliminated in the U.S. back in 2000. Elimination means no continuous transmission for over a year.
So seeing these numbers is definitely a step backwards, and the articles give some concrete examples of where this is happening now. Colorado, for instance.
Yeah, Colorado's confirmed 10 cases this year, and they've linked it back to the Denver International Airport.
An airport? How does that work?
Well, one report detailed how some of the cases were unvaccinated adults who were literally just traveling through the airport. It wasn't necessarily an outbreak originating in Colorado, but rather transmission happening during travel.
So people catching it on the move?
Exactly. They even mention a specific flight, Turkish Airlines Flight 201, where a vaccinated passenger apparently got infected because someone contagious was on board.
Yeah.
It really underscores how global travel plays a role.
And then there was the mention of West Texas, described as an epicenter.
Yes, one source highlighted Gaines County in West Texas specifically. Their vaccination rates are reportedly just over 80%.
80%? That's way below the 95%.
Way below. And it's a stark example of how these specific areas with much lower coverage become really vulnerable spots, sort of like dry tinder for an outbreak.
And who's getting sick mostly? Is it kids?
Largely, yes. The national data mentioned in the sources indicates about 3/4 of the cases are in children under 19.
Okay.
And around 96%, almost all of the cases nationwide, are among people who are either unvaccinated or their vaccination status just isn't known.
So it really comes back to vaccination status.
Overwhelmingly, yes. Lack of vaccination is the primary driver here.
Which leads to the big question, I guess. Why? Why are these vaccination rates falling? Do the sources offer explanation?
They touch on it. Experts cited in the articles speculate about a few potential factors. Things like maybe less collective memory of how bad measles used to be, making the why bother argument harder for some.
Less fear of the disease itself?
Possibly. Combined with, the rise in concerns about vaccine safety in general, hesitancy, and the undeniable impact of misinformation that's out there.
Right. But the Johns Hopkins study itself, it didn't really dig into the reasons for the decline, did it? It more just presented the data.
Correct. Their focus was mapping the decline itself rather than the why. The why is complex and likely involves multiple factors.
Okay, so understanding this decline, this vulnerability, it brings us back to where we started with the CDC's updated travel advice.
Exactly. That decision to recommend the MMR vaccine for all international travel, not just specific high-risk countries.
It reflects this new reality, doesn't it?
It reflects the understanding by health officials that you don't have to go to a country with a massive outbreak to be exposed. Exposure can happen anywhere you encounter international travelers.
It's like in transit.
Precisely. On planes, in airports, during layovers. There was a quote from a researcher saying just that transmission is happening in transit.
So just to be crystal clear on the updated advice for listeners, CDC now says 2 doses of MMR for anyone aged 1 year or older traveling internationally from the U.S.
Correct. And for babies, infants aged 6 to 11 months, they advise getting 1 dose early before international travel.
Okay, so let's connect the dots for everyone listening. Why does this county-level data, these falling rates, this travel advice, why does it matter if you aren't planning an international trip?
That's the critical takeaway, really, because measles is just so contagious.
That 90% infection rate among non-immune contacts.
Right. When vaccination rates fall anywhere, even if it's not in your town or your neighborhood, it chips away at that overall herd immunity. That shield gets weaker for everyone.
It increases the risk across the board.
It does. Maintaining those high vaccination rates, keeping above that 95% ideally, is absolutely crucial if we want to prevent measles from becoming common again here.
Which it was before 2000.
Exactly. That elimination was hailed as a historic public health achievement. We don't want to lose that. keeping rates high is how we maintain it.
So what can people do? What's the practical advice?
Well, the first step is pretty straightforward. Check your own vaccination status
Right.
and your family's. Make sure everyone is up to date.
And that includes adults, right? Not just kids.
Absolutely. Adults should confirm they're immune, either through vaccination records or potentially a blood test if unsure.
And if someone listening has questions, maybe they're hesitant or just unsure about the vaccine.
The best advice consistently given is talk to your healthcare provider, your doctor, your nurse practitioner.
Have that conversation.
Yes. And there was a nice point made by an expert in one piece suggesting providers frame it openly. Instead of just asking, do you have questions? Maybe ask, what questions do you have? It invites a more open discussion.
That makes sense. It's less of a yes-no thing.
Right. It opens the door for dialogue.
Okay, so let's try and quickly summarize the key takeaways from this deep dive based on these sources.
Okay. So fundamentally, we're seeing a worrying rise in measles cases in the U.S.
Driven by a clear, documented decline in childhood MMR vaccination rates across most parts of the country.
This decline is pushing many areas below the herd immunity threshold, making communities more vulnerable.
And this situation, combined with the reality of global travel, has led the CDC to change its advice, now recommending measles vaccination for all international travel because transmission can happen anywhere, even in transit.
Right. It's a recognition of increased risk, both domestically and globally.
We mentioned that measles elimination back in 2000 was called a historic public health achievement. Looking at all this data today, it really does pose a challenging question for us, doesn't it?
It certainly does.
What does it actually take, both from us as individuals and as a society, to hold on to these kinds of public health victories when immunity levels are falling and the world is more connected than ever?
That's the critical question we're facing right now.